mega session FUE procedure. Patients with class 6 hair loss or 7, big area of hair loss, we're going to cover them with 4,000 grafts. It's going to happen in 2 days. This is how the patient look. As you can see, the front, significant hair loss, and the same thing on top and crown. Crown is a huge area, so we're going to put more density in front, less on the crown, but we're going to cover everything with around 4,000 grafts. So we keep the hairline nice and irregular. Priority is the area of maximum density, and below that, behind it. Okay, lift your head. We're going to design the wall exactly the way it is in nature.
Calculator 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 180, 81, 92, 93, 94, 95.
So singles, we're going to make 200 singles. Nice and irregular.
97, 98.
Then we follow with 2s and 3s right on that with maximum density, with lower density, and then a crown with probably 20%.
200, 1.
So we did the front, good density, nice and dense in the front, and then we tapering as we go back, lower density on top. On the top and crown, we made the sides, but we have not placed them. So it's going to go home and relax, come back, and we're going to do it tomorrow. And I guess you're watching us on Instagram too. So how was your day?
Very good, very easy.
Good. So you're going to go home, relax, come back tomorrow. We're going to redo everything again, get more grafts, put them on the crown, and get it all nice and dense.
perfect. Sounds
All
good.
right, good,
Can't wait.
perfect. Of two-day procedure, we have done the frontal area yesterday, so we started extracting hair from the top rim, if you can see, and this is exactly how it looks one day after procedure. Of course, we put an ointment. This is going to be we can easily clean it like that, but we don't want to do that because we want to give them local. So then everything is going to be nicely removed without patient feeling anything. So the front, you can see, is very dense, and we still have to go and fine tune it. But most of the sites are done on the back, and on top we may or may not put hair, depends on how many grafts we're going to get today. So we're shooting for more than 2,000 grafts. We're going to start with local anesthesia around the head, make everything numb, and then get started. The whole day is going to be between extraction and placement of grafts. All right, keep breathing, nice and easy. Big deep breath. Okay, we're going to get started. You're going to feel some little vibration and a little bit of a pinching. After that, everything is going to be numb. Okay. Big deep breath, nice and easy. That's great. If you feel anything, just take a big deep breath, and that will take care of it. Area of extraction. So we are giving a little bit local here and there. He's already numb to mostly non-numb, but I'm just giving a little more local to make sure he's not feeling anything. And this is the area above that. That's going to be now easy to clean it. So just wipe this and everything is going to be clean. So this is how we expect the donor area to be one day after procedure. You see little small red dots that will heal in the next few days, and probably 3 or 4 days after procedure you don't see anything. You may have some like little minimal redness in that area, and that's it. We're almost done with extraction, and it's barely 10. So we have something around 2,000 grafts so far. I'm using Trivellini system, which is very efficient, makes us get good quality graft in a short period of time. So as I'm extracting those, Anna removes them. They're going to be counted on the microscope, and then we are placing them with Mohebi inserter. So that's simultaneous extraction and placement to minimize the time that grafts are staying out of the body and improve the viability of the graft. Doing the final touches to the procedure, we got 41.
07?
07. It's a good number, so we covered front with a very good density. The crown also, at the middle of the crown, the roll area, we had the natural pattern the patient should have, and then it goes away from center. At the top we put very minimal density, which is the area that he has more hair than other places. Our procedure's over. You're going to have the same thing tonight. You're going to take your pills, minimize the swelling, sleep in a little bit upright position for the next few days, and the rest is easy. It's pretty much what we described to you yesterday. Yeah. All right.
Okay.
How was it?
Very good. Very easy. Such a breeze and enjoyable experience.
All right. So we're going to bring you back for hair wash. We show you the first time how to wash it.
Okay.
And then after that, you can wash it for 4 days after procedure. and after day 5 or 6, everything should be back to normal. Pretty much you lose all the scabs.
Okay.
You see the new hair for a couple of weeks, so you enjoy them
Okay.
before they start growing. Actually, after 2 or 3 months.
Okay.
All right.
Sounds good.
Good.
Thank you. Thanks so much.
Pleasure.
Thanks.
Bye.